Did you know there's one small tablet that can help reduce your anxiety and even stop a panic attack, and you may have never even heard of it? Today, I want to talk about Propranolol, a really useful medication for anxiety that I believe is often overlooked. Yet, in my experience, it can be one of the most helpful tools for people struggling with anxiety. Welcome back to The Health Perspective. I'm Dr. Daniel Gordon, a GP, and I'm here to bring you balanced, genuine conversations about health and well-being. The kinds of conversations that I have with my patients in my clinic every single day. Conversations that try and avoid the kind of oversimplification we see so often on social media. Today, I'm going to give you a breakdown on propranolol for anxiety, and specifically how it can help break that terribly vicious cycle of anxiety leading to panic. So, propranolol is a type of medication called a beta blocker. It was originally developed for heart-related conditions like high blood pressure and abnormal heart rhythms. But over time, it's become a valuable tool in mental health too, especially when it comes to treating the physical symptoms of anxiety. Here's how it works. When you're anxious, your body sends chemical messengers, adrenaline and noradrenaline, out. These are part of your fight or flight response. They make your heart race, your palms sweat, your hands shake, and your stomach churn. Imagine standing in a field facing a charging bull. Your body would go into survival mode, and those chemicals would be life-saving. They would help you run, climb, and do whatever you needed to do to escape the threat as fast as possible. But in modern life, that same system can get triggered by things that aren't life-threatening. A public speaking event, a job interview, a first date, or even walking into a crowded room. Now, the problem is that those physical symptoms, the racing heart, the sweaty palms, tingling fingers, can become part of a vicious cycle. You feel them and your brain concludes something's wrong. And that ramps up your anxiety even further. And for many people, this ends in a panic attack. And this is where propranolol comes in. Propranolol works by blocking the effect of those stress chemicals on the body. It doesn't sedate you, it doesn't change your thought patterns, but it breaks the feedback loop. It can stop the physical symptoms from spiraling out of control, and that can help calm you down before your anxiety escalates further. For many of my patients, that's incredibly helpful. I often prescribe propranolol as what we call a pill-in-the-pocket treatment. Something that someone can keep in their pocket to take if required when they feel the anxiety starting to build. For example, before a stressful event or on a particularly tough, anxiety-provoking day. And interestingly, just knowing it's in their pocket helps many of my patients feel better. It gives them back a sense of control, even if they don't end up using it. Another benefit of propranolol is flexibility, because unlike antidepressants, propranolol can be taken as needed or on a regular dosing schedule, whatever you and your doctor decide. It's also, by the way, generally well tolerated over the long term. For my patients, I sometimes find it helpful to use it as a bridge, something to support them while they wait for other treatments like talking therapy or antidepressants to start working. But propranolol isn't for everyone. Because it affects the fight or flight response, there are people who absolutely shouldn't take it. And that includes anyone with lung conditions like asthma or emphysema, people with certain heart problems, or those with a naturally slow heart rate. It can also interfere with how your body detects low blood sugar, so it should be used very cautiously in people with diabetes. And remember, as always, nothing in this video is direct medical advice. I don't know your medical history, so any decision to take propranolol or any medication needs to be made by you in partnership with a qualified healthcare professional who knows you and your medical history. But what I want to emphasize here is this. As you know by now, when I talk about managing mental health, I always come back to the idea of a toolbox approach. I don't promote one-size-fits-all solutions, but propranolol is a tool, one that can be incredibly helpful for some people whose anxiety disrupts their lives to the point that it affects their day-to-day functioning. Whether that's in job interviews, going on a date, or even just leaving the house, propranolol can break that anxiety to panic cycle. And it's a simple option that too often gets overlooked. If this conversation gave you a new way of thinking about anxiety or helped you feel more informed about your options, then I'm happy and I feel like I've done my job. Because I make these videos to offer the kind of calm, evidence-based conversations I have with my patients every day. And if that's something you value, then please support the channel by liking the video, subscribing, or sharing it with someone who might need it. It helps me spread the message, and I genuinely appreciate it more than you can know. Take care, and I'll see you in the next episode.